Even if it's a private member's bill, HIV/AIDS is a big matter. Are you saying it's not a priority to government?
Well, I will not say it's not a priority to government, but I can ably say it came from a private member's bill.
Okay. On the show today, we had invited Dr. Musinguzi from the Ministry of Health to give us the view of the ministry, but unfortunately, he didn't make it to the show. So we'll have to continue without hearing the perspective from the Ministry of Health. Diana, as an advocacy and communications person for Uganet, do you think Parliament is on the right track?
As civil society, we do not oppose the bill. We just do not agree with certain clauses in the bill. And
what are some of these clauses?
Some of these clauses are the clause on mandatory testing, the clause on mandatory disclosure and partner notification, the clause on criminalization of attempted and intentional transmission of HIV. But coupled with all that, we also do not sort of agree with the title of the bill. The East African bill reads the Prevention and Management Bill, which our president, of course, has assented to as of today. So when we talk about control, I think it is not managing a disease. We have reached a point where we cannot control this, but we need to manage it because it is here with us. So we also would like to propose a change in the title of the bill to call it the HIV/AIDS Prevention and Management Bill. So for us as civil society, where I come from...
Will the name really change much?
Yes, because when you talk about management, we are talking about issues that are totally different from controlling a disease. Controlling a disease, you will put tough mechanisms like maybe if we would like to control a disease, we can impose a quarantine. Is that what we are going to do for HIV? Certainly not. But we are using a title, control. So when we say we are managing a disease, we are working with the resources that we already have to cap down the infection rates, to keep everything at bay. But when we say control, it sort of brings a lot of force to the work that we are doing.
Okay. Flavia, that's what Parliament is doing. What does civil society do, or what do the activists do to make sure that these rates that are alarming actually come down?
Suffice to note that the government has done something, but I think it is merely frustrated because service delivery falls short of what is desired. Therefore, as a person living with HIV, I think the bill is right because we are trying to curb discrimination against people living with HIV. We also want to see government providing the requisite services for us people living with HIV to ensure that we live longer and we prevent further transmission of HIV. Just to remember, it's only us and only us who can control that HIV. So if you are going to put punishment to a person who knows the HIV positive, that once you know and to an extent someone says you infected me, you are a potential criminal even before you even get sued. So it means that some of our counterparts, and remember, of all those who are HIV positive, we are about 1.5 million people, Ugandans, living with HIV. Only about a quarter, or slightly higher than that, know their HIV positive status. What we are saying is those who know they are HIV positive and taking care and services are the least of the whole total of 1.5 million. So what we are saying is government in this bill, instead of criminalizing transmission and all those clauses that actually are putting penalty, provide the services.
Okay, but do you agree with the proposal that there should be mandatory testing? Because you're saying few people actually know that they're living with HIV.
Exactly. But also suffice to note that even those who want to test to date, the testing kits are not readily available to the general public of those who want to test. So if you are going to force people to test, or if you want to do it mandatory, then provide the kits for everybody in this country. Test them and have the services ready for people to uptake as soon as they have tested, for both those who are HIV negative and those who are HIV positive.
Okay. Dr. Lulume, you've heard the things that both Diana and Flavia have brought up.
Yes.
Do you have a response to those concerns?
Yes. Fortunately, I have listened to a number of civil society organization activists regarding this bill, and nobody thinks that the bill is of no value. Everybody thinks that the bill has value in itself. There are certain issues that they tend to react to, but of which, of course, we are doing consultation and we want to put clear message. About the title of the bill, I don't think much changes, especially when you talk about control. Of course, the HIV and AIDS is not an ordinary disease. It is, therefore it deserves extraordinary measures, including extraordinary nomenclatures, so that somebody can continue to think about it. So for me, about the title, we can be talking about semantics, but what we need is to control the spread of the disease.